Leishmaniasis Infection. Introduction. All sandflies cause leishmaniasis. Select true or false. Correct. Not all sandflies cause leishmaniasis. Only the ones that are infected with the parasite cause leishmaniasis. The most common form of leishmaniasis is the cutaneous type. Select true or false. Correct. Symptoms of leishmaniasis are slow to appear. Select true or false. Correct. The symptoms of cutaneous leishmaniasis take a few weeks to months to appear. Those of visceral leishmaniasis take months to years. Visceral leishmaniasis is more dangerous than cutaneous leishmaniasis. Select true or false. Correct. Visceral leishmaniasis is fatal if not treated. Cutaneous leishmaniasis causes skin sores that usually heal on their own but can leave scars. Cutaneous leishmaniasis is common in Saudi Arabia. Select true or false. Correct. It is not necessary to wear long-sleeved shirts during the day hours because sandflies don't bite during the day. Select true or false. Correct. Although sandflies are primarily nighttime biters, infection can be acquired during the daytime if resting sandflies are disturbed. The most effective sandfly repellents are those that contain the chemical DEET. Select true or false. Correct. DEET should be applied according to the manufacturer's instructions. Repeated applications may be necessary under conditions of excessive perspiration, wiping, and washing. Bed nets can reduce sandfly bites. Select true or false. Correct. If you are not sleeping in an area that is well screened or air-conditioned, using a bed net helps. Because sandflies are small, you need to use fine mesh netting up to 18 holes per linear inch or more. Leishmaniasis is more common in rural than urban areas. Select true or false. Correct. Leishmaniasis usually is more common in rural than urban areas, but it is found in the outskirts of some cities. Thank you for using Explain.